Good morning, everybody, and welcome to The Balancing Act. We're so glad you're here. I'm Julie Moran.
And I'm Olga Villaverdi. October, you know, is Breast Cancer Awareness Month.
Absolutely.
Very important. So today, The Balancing Act, Julie and I, we are going pink.
That's right. We've got on our versions of pink for you today, and we're going to look at some new ways to test for the disease that are really important.
Also important, a look at improved surgical reconstruction techniques. There are better choices today than ever before. Great news there.
That's right. Breast Cancer Awareness Day on The Balancing Act, and it begins right now.
Ladies, if I were to ask you, are you dense? You'd probably get a little upset with me, right? But guess what? Turns out it's one of the most important questions a woman can ever ask. And Breast Cancer Awareness Month happens to be the perfect time to find out why. Joining me is Dr. Rachel Brem, radiologist and director of breast imaging and intervention. Dr. Rachel Brem from George Washington University and the Brem Foundation, also a breast cancer survivor. Good morning.
Good morning. Wonderful being here.
No, so glad to have you, Doctor. Talk to me about how your foundation really hones in on early detection, early diagnosis. I mean, it's really important for you. It's a passion.
The passion started when I was a young girl at the age of 12. My mother had breast cancer, and I saw the ravages that it could do to a family. And so I decided then as a young girl that I was going to try to do everything I can to make breast cancer a curable disease. And that's how I got here.
Let's talk about that cryptic question. Are you dense? Why is it important to know that? How does that question fit into early detection and early diagnosis?
So breast density is critically important. It's how much breast tissue you have. If you have more than 50% breast tissue in your breasts, then you have dense breast tissue. Less, you're not dense. And the reason that's important is because it impacts how mammograms are interpreted. In women who don't have dense breasts, about 90% of breast cancers can be seen. But in women who have dense breast tissue, a third of breast cancers are not seen. This is because on a mammogram, breast tissue is white and breast cancer is white. So the lack of contrast makes it very difficult to see the cancer, kind of like trying to find a specific cloud on a cloud-filled sky. 40% of American women have dense breast tissue, although almost half of American women don't know what their breast density is. And the other thing is very important is that legislation is having an increasing impact. 19 states now require women to be told what their breast density is. And there's a federal bill before Congress that will make it mandated throughout the country. And it's important to realize that you can't tell what your breast density is except by your mammogram. So you can be perky dense, you can be saggy dense. You can feel anyway and still have dense breasts. It's only something you can tell from your mammogram.
You have a personal story. You are a breast cancer survivor. You were diagnosed in '96. Tell me what happened.
The way I found my cancer is I had a mammogram 2 weeks before this. And then I was charged, which was normal. I was charged with trying to find some new ultrasound equipment in my center. So what I do is I tell all the vendors to bring their ultrasound equipment in, and at the end of the day, when things are quiet, I'll try it on myself.
Really?
So that night, not only did I know which ultrasound unit I wanted to purchase, but I also found my own cancer.
You discovered your own?
And the mammogram, I had a mammogram 2 weeks earlier, and it was normal because I had dense breasts as well.
Oh my gosh, and at that moment, what went through your mind?
I felt very fortunate that I found it, had the opportunity to find it early, when breast cancers are often curable.
God bless. All right, doctor, I have many more questions to ask you, so thank you so much for sharing that personal story. And coming up after the break, Dr. Brem is going to tell us how to find out if we have dense breasts, and she's got some great information about a breast screening option for thousands of women, including me, with dense breasts. So stay right there, don't go anywhere. Welcome back to The Balancing Act, and we're in the middle of a very important discussion with breast cancer advocate and survivor Dr. Rachel Brem from George Washington University and the Brem Foundation. Before the break, we were sharing some shocking statistics about breast density and why it's vital for women to determine whether or not they have dense breasts because of the risk factor. Doctor, thank you so much for joining me again. Let's talk about what options we have if we are dense.
So it's very important for women to know that there are other options to help find these hidden breast cancers. And it's important to realize that not only is mammography more challenging in women with dense breast tissue, but women who have dense breast tissue have a 4 to 6-fold increased risk of developing breast cancer.
Really?
The perfect storm. Harder to find, higher risk of breast cancer. So we need additional options to find these hidden breast cancers. Ultrasound, which is a terrific option, it's comfortable, it uses no radiation, doesn't require an injection. With ultrasound, the contrast is optimized. Breast cancers are black, breast tissue is white. So we can see the cancers that are otherwise hidden because of the lack of contrast in mammography.
And I actually do go to a separate room after my mammogram, and I have a technician do, I guess it's a handheld ultrasound on me.
Right. So that's terrific. But the problem is that handheld ultrasound can be very variable, is very operator dependent. It depends on who's doing it. And so what really was needed is a way to harness the power of ultrasound, which finds 2 to 4 additional cancers per 1,000, or probably about 24,000 additional cancers in the US every year, to harness that in a way that is efficient and effective and can not be operator dependent, so that we can be sure that the entirety of the breast is imaged. I do want to say that ultrasound is in addition to mammography. This does not replace mammography, but it's an important additional tool we have to find more cancer.
So have we advanced that technology to have that extra, let's say, option?
Yes, there is exciting new technology that was developed by GE called ABUS, Automated Breast Ultrasound.
How does it work?
It's designed to use ultrasound, again, a comfortable, no radiation examination to find these hidden breast cancers. And it images each part of the breast with a specially designed, very sophisticated piece of equipment that is the only FDA-approved device to screen women with dense breast tissue available in the United States.
So definitely something that I should look into.
Absolutely.
Doctor, I know through your foundation you really want a lot of women to be more aware, educated, self-advocacy. Really important today, isn't it?
Absolutely. A woman is her own best advocate, and she has the responsibility to know her body and know if there's anything else she can do to be the healthiest that she can be. And that's why it's very important for women to know what their breast density is. But until every woman is told what her breast density is, she has to ask what it is and ask what else she can do, such as ABUS, to find these additional mammographically hidden breast cancers.
And once you find out, also learn about these misconceptions that are out there as well, correct?
That's right. Breast density changes with age, it decreases. But 40% of American women have dense breast tissue. In women in their 40s, it's 70%. But more than a third of women in their 70s have dense breast tissue.
Really?
So regardless of your age, you may have normal dense breast tissue, which may require additional imaging to optimize the diagnosis of early curable breast cancer.
Thank you so much, doctor, for all this information. I'm going to look into the ABUS, and I know there's a famous line that says different test for?
Different breast, individualized screening for all women.
We are not the same. Thank you so much for your time. And of course, head to thebalancingact.com for more information, and don't forget to join us on Facebook and Twitter and find out if you have dense breasts. Very important, right, doctor?
Absolutely.
There you go. If you're one of the millions of breast cancer survivors out there, congratulations. And yes, you obviously feel so blessed to be alive. But at the same time, you probably also know how difficult it is to feel pretty again. A cancer diagnosis is emotional and traumatic. But for a woman, the loss of a breast can also be a distressing and very personal loss. Breast reconstruction has certainly come a long way over the years, thanks to renowned plastic and reconstruction surgeons like my guest, Dr. Christina O'Shaughnessy. She's here to talk about some of the surgical challenges and new options for breast reconstruction. Along with her, one of her special patients, Kimberly Colley. Good morning.
Good morning.
Thank you so much for being here.
Thank you.
Kimberly, let me start with you. Can you share your personal story, your diagnosis?
I can. In 2011, I went in for my regular mammogram, and Ironically, I had almost canceled that appointment, and I was just going to put it off just for a little bit, and I talked myself into finally just going. It was no big deal, and that was the day that my cancer was found. A lot of things happened really quick after that, and you have to make a lot of really fast decisions, and I decided to have a bilateral mastectomy followed by reconstruction.
Were you scared?
I was absolutely terrified. It was the scariest thing I've ever gone through in my entire life.
Doctor, Kimberly's story is a story I've heard so much. From a doctor's perspective, what are some of the different reconstructive challenges with breast cancer patients?
Sure. So in discussing the type and timing of breast reconstruction, I have to take into consideration many factors. And the reconstructive plan is individualized for each patient. From a plastic surgeon's perspective, there are many reconstructive challenges, and they can be divided up into patient issues such as comorbidities, or into previous breast surgeries or previous breast treatments such as radiation, or issues related to the mastectomy itself. As far as one of the main reconstructive challenges, it has to do with patient issues that may cause adverse issues with wound healing at the time of mastectomy. Previous breast surgery can lead to scarring. Previous radiation therapy can cause extensive tissue damage. And then at the time of mastectomy, there can be obliteration of the breast borders that we need to recreate.
So what do you do when you're faced with all these challenges, doctor?
Well, the goal of breast reconstruction is to recreate the breast, and there are many options to do that. You can use implant-based reconstruction like Kimberly had, or you can use your own tissues in the form of tissue from either the belly, the back, or the abdomen. And it really depends on each patient's individual situation. If a patient has had extensive tissue damage from previous surgery or from radiation therapy, then it might be best for the patient to use their own tissues for reconstruction. But if a patient is going to undergo radiation therapy after a mastectomy, we may want to start with an expander. There have been several innovative technologies, including acellular dermal matrices or tissue grafts, that have expanded the options for breast reconstruction and has allowed us to reconstruct breast with advanced techniques over some of the techniques available today.
I'm really glad we're talking about this because I didn't realize all the factors involved. When we come back, we're going to talk more with the doctor and Kimberly, because coming up after the break, we're going to hear more about some of the groundbreaking techniques and technologies that are now available to surgeons like Dr. O'Shaughnessy and patients like Kimberly who are looking to feel whole again after breast cancer. Stay right there. Welcome back. We're in the middle of a very special episode of The Balancing Act dedicated to breast cancer. I'd like to welcome back Kimberly Colley and Dr. Christina O'Shaughnessy. Before the break, we were discussing Kimberly's breast cancer journey and some of the challenges that plastic surgeons like Dr. O'Shaughnessy face when trying to reconstruct a woman's breast after cancer. Thank you so much for joining me again. Kimberly, I'm going to start with you. Tell me what you opted for after your diagnosis and what you did.
I went with the bilateral mastectomy.
Okay.
I had a pretty significant amount of tissue loss in my left side. I had tissue reinforcement, and then I did the fat grafting. And I even got a little bit of liposuction.
Oh, well, hoo-hoo, why
Yes,
not, right?
Of course.
That's a bonus.
That's exactly what it was.
Doctor, talk to me about these techniques, if you will.
Sure. So the tissue graft that Kimberly is referring to is acellular dermal matrix, or regenerative tissue matrix called alloderm, and it's from LifeCell. And it is processed in such a way that the cells are removed. It's donated from humans, and there's a proprietary technique. After the cells are removed, you're left with this scaffold that the patient's own blood vessels and cells can then grow into.
Really?
So it becomes part of them. It's regenerative, and it acts like native tissue, so it minimizes the risk of rejection. So at the time of mastectomy, a tissue expander is placed, and then alloderm is sutured from the muscle down to the chest wall to help to recreate the breast borders and to also help to supplement or reinforce the weakened tissue that can be damaged at the time of mastectomy. I used to have to raise surrounding muscles, and that was very painful for patients. It was also very traumatic, and I no longer have to do that with the use of alloderm.
Now, what about fat grafting procedures?
So fat cells are taken from other areas of the body where there's excess, such as the abdomen or the thighs, and then it's transferred to the breast to fill in contour deformities or to restore shape or volume. And the fat is taken with traditional liposuction techniques and cannulas like Kimberly described, so patients will get an added benefit to it. So traditionally, fat grafting has been a little bit unpredictable, and that's because of variable resorption rates. And it's because there's no standardization of the processing step in fat grafting. So a new technology called the Revolve system allows us to effectively harvest and process large volumes of high-quality fat for reinjection into the breast after mastectomy. Revolve controls many of the critical variables that are important in the processing step of fat grafting.
And are all these new technologies for all patients?
Well, breast reconstruction is individualized for each patient.
Sure.
So I do think it's important for each patient to talk to their surgeon about the risk and benefits of both Alloderm and Revolve to be sure that they are right for that patient. Innovations and advances in breast reconstruction, such as Revolve and Alloderm, have really changed breast reconstruction. It's opened up many options, and it's allowed us to optimize outcomes for patients with breast cancer who have to undergo bilateral mastectomy, like Kimberly.
And I do want to bring you in, Kimberly, in terms of your outcome. You look gorgeous. I know you're feeling great. Tell me where you are today.
I'm doing fabulous. I'm in remission, and I'm just doing wonderful. I have had cancer, but cancer's never had me.
Thank you so much. God bless you.
Thank you so much.
Thank you so much, sweetheart. Doctor, thank you so much for the information. You've taught me a lot today, and I'm very happy to have you here. Come back with anything new you might have to tell us, okay?
Thank you very much.
Again, good luck to you, Kimberly.
Thank you.
And make sure to head to thebalancingact.com for more information. That's thebalancingact.com. And don't forget to join us always on Facebook and Twitter.
Thanks for spending part of your morning with us. You can have that second cup of coffee.
Third cup.
There we are. We are too. We hope we've shed some light on breast cancer, new testing options, new reconstructive techniques.
Really important information. And remember, lots more on our website. It's thebalancingact.com. That's thebalancingact.com.
That's very good. Thank you for repeating that. And find us on Facebook and follow us on Twitter. Until next time, remember to
Find
your balance. So long, everybody.
Bye-bye.